Hello everyone and welcome back to this new video. Today I want to share how to perform a vitrectomy in phakic patients. I generally reserve this approach for younger patients or those who won't require a highly complex posterior pole surgery and who are unlikely to need a second procedure due to a secondary cataract formation. There are more criteria for this selecting approach, but we can discuss those in another video. Now, the key here is to successfully complete the surgery without damaging the lens in order to avoid complications. So first, the obvious, as you can see now in the image. Always place the trocars 4 mm from the limbus and direct their tips toward the posterior pole, usually aiming toward the optic nerve to prevent any risk of the trocar tip touching the lens. Now, I personally always like to perform an anterior vitrectomy and anterior hyaloidectomy. In phakic patients, this step is a bit more challenging, so take your time and avoid getting too close to the lens to prevent posterior capsule damage. Now, traditionally, we have been taught that when performing vitrectomy in phakic patients, you should avoid crossing the midline, meaning you should distinguish between the left and right zones and treat each side without crossing instruments. However, to be honest, that's not always practical. Here's a simple and effective technique I want to share with you. You can cross the midline safely if you slightly tilt the eye in the direction where you will be working with the vitrector tip. This maneuver creates more space and reduces the risk of the instrument touching the posterior capsule. It's absolutely essential to always be aware that the patient is phakic. Use smooth movements, never cross abruptly, and you will find that it's quite manageable. Applying laser, on the other hand, can be one of the most challenging parts in these patients. Take a look at this external shot and see how I avoid sudden movements. I always direct the tips of both of the endoillumination and the laser toward the posterior pole, and I tilt the eye toward the peripheral area I want to treat. This makes crossing easier and more practical. There may be some untreated areas that can be addressed later under air. Remember that the field of view always expands when the cavity is filled with air. You can perform indentation as well. Again, do it gently and keep the eye slightly tilted to avoid lens contact. The end of the procedure is the same. Remember, when using air or gas, it's important to instruct the patient not to lie on their back to avoid cataract formation and feathery opacities. So, I hope this was helpful. Don't forget to subscribe for more content and stay tuned for the Eyesight Academy podcast. Thanks for watching.